Hello, I'm Dr. Mentasana, and today I'd like to talk to you a little bit about the dangers of ignoring tooth decay and how a simple filling can save your tooth from big problems down the line. Tooth decay is caused by bacteria that lives in your mouth and forms a plaque on your teeth. When the plaque sits on the tooth long enough, it will soften the tooth and form a dark spot, sometimes known as a cavity or tooth decay. When a tooth has a filling in it, the seam between the filling and the tooth can break down over time from normal wear and tear, and let cavity causing bacteria under the old filling. Signs that this is happening are discoloration in the grooves of the teeth or around old fillings, and gaps opening up between the filling and tooth. This can happen with silver fillings and tooth-colored fillings alike. Decay can also be seen on an X-ray, showing up as dark spots in the enamel between the teeth. If the decay is not taken care of quickly, it can grow, putting your tooth at risk for more serious treatment, such as a root canal. Tooth decay is progressive. Until it is treated, the decay process spreads throughout the tooth, picking up momentum over time. At first, you cannot feel it, but once it is advanced and too late for a filling, it can eventually cause pain, infection, and ultimately tooth loss. Teeth are hard organic structures, much like an apple, only much harder. Have you ever seen a dark spot in an apple? The dark spot decaying and getting softer. The decay will eventually grow to consume the whole apple as it rots the apple. The same thing happens with a tooth, unless we stop it with a dental filling procedure. If you put a rotten apple in a basket of good apples, do you know what happens? The whole basket of apples will eventually rot. The reason for this is because decay of any kind is bacterially based and can spread, if not treated, increasing your risk of more decay in other teeth. As you can see in this photo, the seam between the filling and the tooth have small gaps. This allows bacteria from the mouth to have a straight line access to a deeper part of the tooth under the filling. This photo shows the decay that was happening under the filling. Without removing the filling and underlying tooth decay, the decay will progress to more advanced stages and eventually cause pain or infection. If decay is found early enough, a dental filling procedure can stop it before it reaches the advanced stage. In order to stop the decay process, the portion of the tooth infected with bacteria must be removed. If treated early, it can stop the decay from damaging your tooth and leave your tooth strong and healthy. A filling is a material that is placed in the hole to restore the tooth to its original shape and strength, and seal out the bacteria from getting to the deeper, more vulnerable parts of the tooth. With a tooth-colored filling, it can hardly be noticed. Getting your new filling is necessary in order to prevent further damage to your tooth. It is best to stop the decay as soon as you find it, and we are eager to help stop your tooth decay and restore your tooth back to health. Schedule your appointment today and give yourself peace of mind.